Hello, everybody. I'm Dr. Rajesh Taneja. I'm a senior consultant urology and robotic surgery at Indraprasth Apollo Hospital, New Delhi. So today I'm here to talk about the advantages of robotic surgery and what exactly is it? It is actually a technology to reach where the human hand cannot reach. For example, when we talk about surgery, we have something called an abdomen between our chest and the belly and the pelvis. And this abdomen has many organs. And then we have very remote corners where we cannot see everything or where our hands can go sometimes, but our eyes cannot go. So robotics is a technology where we have our eyes going into the corners because of the camera, the 3D camera that we have. And that 3D camera has twin lenses. It is like two eyes. The diameter of this camera is 6 millimeters. So imagine somebody with a face which is as wide as 6 millimeters reaching the corner with two eyes and generating an image exactly as we are seeing here. So this is how the robotic eye or the robotic camera transmits the images to the surgeon or whoever is operating and gives the access to the remotest corners of the body. So for example, if I were to operate upon a gland called prostate gland, which is situated much deeper in pelvis, much lower than the uterus in women, there is a small gland of the size of a walnut, which is situated below the urinary bladder, just before the urinary passage exits out in a male. So imagine you cannot see once you open up the abdomen, it is extremely difficult to see this organ, and equally difficult it is to operate upon this organ in case you need to remove it. So when we remove this organ, it is usually for cancer of prostate, and we need to remove this prostate in entirety. We cannot leave behind any part of the prostate gland. So when we have to remove this, we need to be sure that we are not damaging the structures adjacent to this gland. At the same time, we want to make sure that there is minimal blood loss. And we want to make sure that we have taken all the cancer which is there in this prostate gland. So robotic technology gives us an advantage. One, the camera, which is, as I explained, is a twin camera, two lenses, two objectives fixed within 3 to 4 millimeters over a structure which is 6 millimeters wide. We can keep that camera close to the bottom of the belly where we can see in a magnified manner these tissues, and we can be very precise in cutting. Similarly, when my hand goes into the abdomen for a surgery, my hand requires space because it has got a width of 6 centimeters. Suppose the robotic arms, which are 4 millimeters in diameter, if they are inserted and they reach there, they would not be disturbing the surrounding organs. So the best thing is to go to the target organ, operate upon it with excellent 3D vision, and at the same time not disturbing the other organs in vicinity. That is what is achieved by the robotic arms. Now, somebody may ask, the same thing can be done with laparoscopy. Yes, what is the difference between laparoscopy and robotics? The advantage is that the laparoscopic surgeon, or laparoscopic instruments, while they're working, they have only two dimensions, X and Y, of the movement of their final jaws, or we call it as blades of the scissors. Whereas with robotic instruments, we have X, Y, and Z direction pulleys which are integrated into the instrument, and we can do everything what I can do with my hand. In fact, the robotic instrument has a much better freedom of movement, we say, or angle of movement. So it's much better than the human hand naturally that it has. So with the advent of robotic instrument and the advent of robotic camera, we can access the inaccessible corners, we can cut precisely, we can save the damage to the organs in vicinity, which means early recovery, reduced complication, and early healing and shorter hospital stay when we use the robotic surgery. So I will emphasize that there are so many places, whether it is in the abdomen and now whether it is in thorax, which are not accessible to usual surgical procedures, like looking there and putting your hand there without disturbing the major surrounding structures. Then robotic surgery certainly scores over these areas. Robotic surgery has been in vogue for last 2 decades, and we have been doing it as good as in any other place in the globe. So we have a group of patients, we call it cohort. We have a cohort of patients who have undergone robotic surgery, and they have actually been benefited by the advantages that I have just mentioned. It has to be seen to be believed that when you do a robotic surgery for a given case, then the results are much better. The healing is much faster. The healing is actually the same, but the patient recovery is faster. Healing takes 6 weeks, whichever way you treat. Recovery of the patient is much faster. The hospital stay is much shorter, and the patient goes back to work much quicker as compared to routine open surgery done for the same disease. And in some cases, like cancer of prostate, where we have to remove the prostate and join the bladder to the urethra, it is a stitching procedure. And if you do it with hand and if you do it with robotics, there is a difference in terms of the outcome of the junction which is being made between bladder and urethra. So it is the stitching becomes much easier for the surgeon who is already trained in that. It is much better for the patient because the healing is much better when the alignment of the urethra, which is a tube, to the bladder, which is the reservoir, is done with robotic surgery. The role of robotic surgery is increasing by the day. Those people who were initially using open surgery or laparoscopic techniques, once they start having access to robotics and once they start doing robotics, they realize that it is the advantages, which is also to some extent the advantages to the surgeon, because if you are operating with laparoscopy, then at the end of the day, the surgeon has tired shoulders, tired elbows. But when you are doing a robotic surgery, then it is the ergonomics are such that the surgeon is not as tired. And if the surgeon is struggling and if the surgeon is tired, then certainly the chances of complications are high. So the chances of complications are reduced in robotic surgery because the surgeon is much comfortable once he attains the skills to operate through the robotic surgery instead of routine open or laparoscopic surgery. So I can tell you that the robotics is here to stay. The robotics is going to replace, in majority of cases wherever possible, the open surgery or laparoscopic surgery, unless there are certain very simple laparoscopic procedures like gallbladder surgery. Now, laparoscopic gallbladder surgery may never be replaced by robotics, but you never know. In times to come, that also may happen. So if there is anything else, I'm always available. There are my details in terms of my email, in terms of my website, in terms of my telephone, they are all available. And I'm sure that if you have any more queries, I will be very happy to answer. Thank you very much.
Yeah, my name is Latima Mwaniki, retired Air Force captain. Around 2010, I've always been a very ardent squash player and good in sports. I started having hematuria, lots of blood in my urine after squash, which was painless. Later, it was diagnosed as bladder cancer. I went through chemotherapies. And then finally, I was told that the bladder was very bad and that it might have to be removed. So I heard from friends that in India I may be able to get good chemotherapy. And I decided to ask around, and I was told about Dr. Taneja. I Googled and found that he was a good robotic surgery neurology. And I decided to come to see him. When I came to see him in 2014, he told me there was no cancer in my system. So he sent me back to Kenya, that I had no problem at all. But after a couple of reviews, in 2016, he found that the bladder had full of cancer. And he decided that we must remove it. We removed it in 2016. And I've never had any problems. I've been here every 6 months for reviews. Last year, he told me it's 1 year review. I'm now back in for the annual review after 2018. Now it's 2017. And I've had no problems at all. So far, I'm doing very well. I still jog. I still swim. Back in Kenya, I'm running a small aviation school, which is pretty busy. And I'm not having any complications at all.
Thank you very much, Mr. Latimer, for all those kind words. So I'm Dr. Rajesh Taneja. I'm a genitourinary surgeon, urologist, and a robotic surgeon. I've been having my practice for the last 30 years in urology, and I've been doing robotic surgery since 2012. And Mr. Latimer came to me with the diagnosis of cancer of bladder, but since he had received chemotherapy, on the initial reviews there were no cancers, so we kept him on follow-up. But later on, during the follow-up, we picked up the signs of cancer coming back. And this time, we decided to take the bladder off. So I conducted a robotic surgery, robotic radical cystectomy, with an ileal conduit diversion on him in February 2016. And it went off uneventful. And I'm very happy to see that he is enjoying good health. There is no recurrence of cancer. And he's maintaining good health, good sports, good jogging, and he indulges in his usual sports activities, which makes me very happy to see a patient like that. And I hope that the robotic surgery brings such good health to all the patients all over the world. Robotic surgery makes a big difference in as far as the incision is concerned. You don't have to make huge incision in the abdomen. And when we do robotic surgery, the blood loss is minimal. The robotic instruments have endo wrists, which go in. The width of the endo wrist is 6 millimeters. And if you compare it with my wrist, which is 6 centimeters, you can make out that the finesse of an endo wrist, which is 10 times smaller than my hand, is certainly going to be much better and much more precise in terms of dissection and reconstruction of the tissues. So that is why robotic surgery gives a much better result in terms of recovery, in terms of clearance of cancer, and it is very kind to the patient.
My name is A.K. Sharma, 69 years old. In the month of March itself, I have been diagnosed as a prostate cancer. Hereby, then I got a lot of options. The doctor advised me, and that options were going for the surgery, going for the radiation, all things. Ultimately, decided to go for the surgery for my prostate problem. And in the surgery also there were some options for their open surgery, laparoscopic and robotic. While considering all the issues, then I find that robotic could be the one of the best choice for me, because in the robotic it has got a minimum blood loss, it has got a minimum hospitalization period, and the speedy recovery of the patient is also one of the consideration. I met to Dr. Taneja, and he advised. So I asked him, when should I come? So he said, okay, just come after 3 or 4 days. And he gave me the time, and I said, okay. And I have been admitted on 14th, 15th May. I have been undergone for the robotic surgery. I had a good, wonderful experience at Apollo with Dr. Rajesh Taneja. He was the guide. He was really excellent. He guided me. So, and I think he was so confident, and that gave me a lot of confidence to me about the robotic surgery. And 15th, my robotic surgery done. In the evening, because in the came in the transition and everything fine. Next day, Dr. Taneja came and he allowed me to, Sharmaji, you please walk. And he allowed me, and he said within 2 or 3 days, and you can eat anything or anything, whatever. So just on 15th surgery done, and 18th morning I have been discharged from there without any problem or anything else. It was a wonderful experience of the robotic surgery with Dr. Taneja. So in continuation to my experience about the robotic surgery, I would like to make normally with the open surgery, the general, people told me that there are a lot of problem about the incontinence. It takes about years, so 7 to 8 or 9 months. But I would like to share with this after the robotic surgery, just after the 6 weeks when I met in OPD Dr. Taneja, he asked about the incontinence, and my incontinence problem about 50 to 60% was good enough. And after the 8th or 9th week, it was approximately 90% I was control on my incontinence. It was a wonderful experience. And second problem normally about the impotence, then I still remember Dr. Rajesh Taneja's version of that. Sharma ji, as a doctor, I would like to know about something about your impotence problem. Sir, I have never thought on that line. Then he said, no, as a doctor, I would definitely like to do. Do you have any time any such problem, some pressure or some thing happens to you? Then I really got shy on that part. When I heard this, as you are asking me this question. So now ultimately, no, I would like to know as my experience. Sir, kabhi kuch hota hai. So anyhow, thanks. Lastly, I would like to sum up the thing. One should have a trust in the system, trust in the doctor, trust in the God. Ultimately, the God grace is also comes through the doctor only. And here Dr. Rajesh Taneja, I would have to, he's a really wonderful experience and a person. I really appreciate his behavior. Whenever I used to come to the doctor, I come with lot of the questions, lot of the queries, and I appreciate in the way he says, Sharma, you sit down here and you ask anything. You will leave this seat only when you become satisfied about all your problems. And he is a wonderful nature. I really appreciate to everyone. Please must, anytime you have got any urology problem or the prostate problem, he is one of the excellent doctor with a lot of wonderful qualities.